The appendicular skeleton is really rather simple in comparison to that of the axial skeleton. There's a few landmarks, there's a few extra things, but really is going to be one of the easier things you're going to study this session. So the appendicular skeleton, remember that it just means appendage. So the appendages or the extremities or things like that. So you're going to be including your arm bones. You're going to be including your shoulder blade, your clavicle. You're going to include the bones of the pelvis, minus the sacrum and coccyx, of course. And you're going to include the leg bones. We're going to go ahead and begin in the upper portion of your skeletal system, starting off with the clavicle. We're looking at it. We're looking at somebody in this picture straight on. All we're seeing is that wonderful little clavicle. What's going on, again, if you remember back with our discussion about the thoracic bones, the thorax, in that sternum there's a clavicular notch. That clavicular notch meets up with the medial aspect of that clavicle, that sternal end. We're not going to care about the impression of the costoclavicular ligament or the conoid tubercle. All we're just going to know is that we have a blunt end over here, more of a smushed down end over here on the acromial end. Now, why it's called the acromial end would require us to go ahead and switch over to the shoulder, the scapula going on. A portion, you're going to notice several things about the scapula. This is the posterior view. This is as if you were looking at somebody from behind. This is from somebody from in front, but you've peeled away everything else in front of you to look at what's underneath that scapula. That clavicle is going to go ahead and merge onto or connect to that acromion process right here. And that acromion process goes into this spine, the scapular spine. You can actually feel that spine if you go ahead and reach behind you, rotate behind your back, and you're going to feel this hard bone, surprise, surprise, bone-like structure. It is bone. That hard bone structure. That is the spine. So the acromion is continuous with that of the spine. If we take a sideways view of it, you'll see the acromion. That's again where the clavicle is merging on right there. You got also here in the middle that glenoid cavity. This is where your arm bone, your upper arm bone is going to meet up. So that glenoid cavity is the actual cavity that's receiving the head of that upper arm bone called the humerus. And it is one of the most movable, most easily twist around, circle around, and all that stuff of all your joints. We'll be discussing about that next week, as well as a little bit more about dislocation. But that glenoid cavity, again, glenoid cavity is again the place where you're going to have that attachment and that joint. So if we were to look at the humerus, I'm going to scroll back up here, and we're going to look at this one. We're going to use this as our basis. This is the anterior view, so if you're looking at someone straight on, you can look in their eyeballs and you decide to trace your eyes down to their right, you're going to be looking at it this way. You're going to notice that the head of that humerus is covered in articular cartilage. Well, it does, as also you're going to notice that on this drawing at least, that there are two necks. Usually with a head, you usually have some type of neck. You got the anatomical neck, which is like the boundary or the ending of that articular tissue, but the surgical neck, the one that's probably going to break most easily and at that point, is right there. Something to note about this region between the head and that surgical neck are these two bones and the sulcus right here, or these two bumps and the sulcus right here. Now, those bumps are called tubercles. If you remember, it's just a really large projection. In between that is that sulcus, which is housing that tendon. You can feel these two bumps by putting your hand on the anterior portion of your shoulder lifting up your arm just a tiny bit and rotating that arm. And you'll feel one big bump, a divot, and then another huge bump. In between those bumps is that intertubercular sulcus. The lesser tubercle, which is a little bit smaller and not as high up, is up more anterior, with the greater tubercle being more lateral and going more posteriorly than that of the lesser tubercle. If you follow down that sulcus, you're going to notice some indentations, some roughness of the bone. If you remember my discussion about roughness of the bone, usually if you see some rough spots, it means that something is attaching to it. And by golly, look at that. There's a tuberosity there, and it's the deltoid tuberosity. So you can bet your bottom dollar that your deltoid muscle is attaching to that deltoid tuberosity. You go ahead and follow down that humerus down more distally, and you get to your condyles and epicondyles. If you remember the bone markings, condyles usually referred to the lower portions of that joint, but the epicondyles are just above that joint. They're rough, and usually there are a bunch of muscles attaching there. On the back of that humerus, so you turn the person around, and you're going to notice an olecranian fossa. So if you have a bump on your elbow, that's on your ulna. That comes from your ulna, and your humerus accommodates it and gives it an olecranian fossa. If you remember a fossa, that's just an indentation. Let's go ahead and scroll down that arm just a tiny bit more, and we're going to get to the radial bone and the ulna. The radius and the ulna. The radius and the ulna is your forearm bones. Now, how do you remember which side of the bone is? Easiest thing to do is remember that the ulna is on the more medial aspect, while your radial bone is rad. It's right by your thumb. If you stick your thumb up, you're pretty rad, so your radius is rad right by your thumb. Some things to note and that are important. The head of your radius is actually up here in your elbow joint. We're going to call it the elbow joint now for now. But you can feel it if you go ahead and put your hand on the posterior portion and more lateral aspect of your arm, and then rotate your arm. Do a princess wave. And you'll feel that head of your radius move. The ulna's head is actually on the opposite side. It's more distal, closer to that hand. The head of that ulna has a styloid process, which only allows the hand to wave side to side to a certain degree. The radius also has that same setup, only allowing that hand to move to a certain degree, but much less so than that of that ulna. Again, one little quick thing to note about the ulna is that it has that olecranian process of the olecranon, which inserts into that portion of the humerus, and it gives you that bump. So that bump is indeed a portion of your forearm, your ulna. Carpal bones, there are small 8 carpal bones that are all held together by ligaments. There isn't really an easy way to remember this except for this mnemonic: stop letting those people touch the cadaver's hand. Kind of weird, but we're going to run with it. Stop scaphoid letting lunate those triquetrum people pisiform touch trapezium, the trapezoid cadaver's capitate hand hamate. We are looking at the proximal versus distal row. The first 4 are the proximal. Remember that proximal means closer to the body and a limb. So these 4 right here are talked about starting laterally to medially. So you're going to start over here. So scaphoid, lunate, pisiform, and triquetrum right there. If we go down to the lateral aspect, we got ourselves the trapezium, trapezoid. We got ourselves the capitate and the hamate as well. So these are your carpal bones. Your metacarpal bones are your, notice that the carpal bones are short bones. You got the metacarpal bones, which are considered long bones, 1, 2, 3, 4, 5. And then just beyond those metacarpal bones are your bones of your phalanges. With that, that is the end of the upper extremities. We're going to be discussing the pelvic girdle next. Have a good one.